Bismillahirrahmanirrahim. In this video, we are going to talk about barbiturates. First thing about barbiturates is that they are injectable anesthetics. They also have anticonvulsant properties. They provide no analgesia, and it is important to note that they have no analgesia. The antidote to barbiturates is nicotinamide. Next thing, perivascular injection will cause tissue necrosis. So, always inject barbiturates in an IV line. Because even if by mistake the barbiturates is injected intramuscularly, the whole tissue will get necrosis. So you have to be careful in that as a clinician. The mode of action of barbiturates is they are GABA receptor activators. By through GABA activation, they will cause central nervous system depression, and through that depression, unconsciousness will result. Next we have is the effect of barbiturates on three major systems: central nervous system, cardiovascular system, and respiratory system. As far as central nervous system is concerned, they will cause depression and decrease in intracranial pressure, decrease in cerebral blood flow. And it is important to remember this because in our previous video we have talked about ketamine, and we have seen that ketamine increases the intracranial pressure, and we can at that time we can use barbiturates along with ketamine to balance this property, that ketamines will tend to increase, meanwhile barbiturates will tend to decrease the intracranial pressure. So if you are using ketamine and you are having the issues because of the ketamine's property of increasing the pressure, you can use at the same time this to lower that pressure and avoid any contraindication. In the cardiovascular system, it increases heart rate, causes vasodilation of skeleton and cutaneous blood vessels. In the respiratory system, it causes transient periods of apnea and bronchoconstriction. To avoid these things, try to inject very slowly, because if you will inject rapidly, straightforward prolonged apnea will happen, and sudden bronchoconstriction will cause a respiratory collapse and will cause the dangers of death of the animal. Next, we have the three important functions or three important clinical uses of barbiturates. Number one is euthanasia. Pentobarbital is specifically used as an anesthetic agent. Number two, seizure control or anticonvulsant. Phenobarbitals are used for this purpose. And number three is barbiturates are used as an anesthetic agents like thiopental or all other barbiturates other than pentobarbital and phenobarbital. So first, let us talk about this anticonvulsant property of phenobarbital. Remember that in dogs and cats, the first line of choice as an anticonvulsant is phenobarbital. I'm adding over here one more important thing, that basically in veterinary medicine there are three things. First we have these barbiturates as an anticonvulsants, then we have another drug, and then in the third line of choice we have some other drugs, but we as anticonvulsants, but we will talk about those three sets of drugs separately when we will talk about anticonvulsant in this series of veterinary anesthesia. But here you should remember that in those anticonvulsant, the first choice in cats and dogs is this phenobarbital. And do not mix phenobarbital with pentobarbital, as both names start with pp, but both have opposite effects. Phenobarbital is acting as a savior for your animal by controlling its seizures, but pentobarbital will cause the euthanasia and death of your animal. So do not mix these names. And phenobarbital also has a hepatotoxic effect, so it is contraindicated if the patient is also having the liver disease. Next, we will talk about the property number one of euthanasia in these two sections. That pentobarbital is used used for euthanasia, and its mode of action is that it causes extreme central nervous system depression when given in overdose. This rapidly and painlessly depresses all the vital functions of central nervous system. So loss of consciousness occurs in seconds and death within minutes. But if you are having no IV line, then you can use the same pentobarbital as intraperitoneal injection, along with the lidocaine, which is considered as an appropriate method of euthanasia. Also, you can use this pentobarbital as intra-organ euthanasia by injecting directly into a heart, intracardiac, or intrahepatic, like in liver, or you can use intraosseous, like in the bone. So these are the routes. So that was the this property, euthanasia. And next, you can use these barbiturates as an aesthetic agents to, like, thiopental or other. um, that was all about barbiturates. Thank you.